In this video, we will discuss how vitamin A works in our body, from biochemical pathways to pathogenesis behind vitamin A deficiency. Vitamin A exists in several forms. Retinal, or so-called retinaldehyde, is the aldehyde form, which is the key molecule to the visual cycle in the retina. Retinol is the alcohol form, often found in our blood circulation. Retinoic acid is the acid form, which is vital for gene transcription and epithelial integrity. We can convert one form into another, depending on physiological needs, but retinoic acid is generally the final form used for regulation of gene expression. Vitamin A is a fat-soluble vitamin, and vitamin A plays a huge role in our organism as antioxidant. This vitamin is also crucial for vision, immune function, growth, and cellular differentiation. Vitamin A found in the liver and leafy vegetables. There are three major applications of vitamin A in clinical practice. First of all, vitamin A stimulates immune system. For example, vitamin A can improve outcomes in patients with measles. Also, vitamin A is used in acne treatment. For example, isotretinoin, which is derivative of vitamin A, nowadays is considered as one of the most effective agents for severe cystic acne. And also, ETRA, which is all-trans-retinoic acid, is the first-line agent in treatment of acute promyelocytic leukemia, which is a high-yield fact for examination. So, to explain all these effects, and also to understand how vitamin A deficiency develops, we have to know the pathway of vitamin A in our organism. With diet, we receive vitamin A either as preformed retinol from animal sources, or as beta-carotene from plant sources like carrots, for example. Once we consume these products, vitamin A comes to the small intestine, where vitamin A will be absorbed by duodenal enterocytes. But recall that for proper absorption, enterocytes require bile acids and salts, which help emulsify fat-soluble substances, because without emulsification, absorption will not work. And we have to remember that bile is secreted by the gallbladder, but is produced by the liver. Within the enterocytes, vitamin A is packed with other lipids into kilomicrons, and in form of kilomicrons, vitamin A is transported to the liver, where vitamin A is stored in a stellate, also called ITO cells. And when tissues require vitamin A, liver binds vitamin A to retinol binding protein, and in this form, liver secretes vitamin A into the blood. Once vitamin A reaches tissues, there are two major possibilities. First of all, tissues can convert vitamin A to retinol, which is an essential molecule for retina function. Another possibility is conversion of vitamin A to retinoic acid, which binds to nuclear receptors as retinoic acid receptor or retinoid X receptor, and by this retinoic acid provides regulation of genes involved in growth, differentiation, and maintenance of epithelial cells. Now, let's discuss in details the function of vitamin A in our body. As we already know, we have two major forms of vitamin A. It's retinal and retinoic acid. Retinal plays a crucial role in night vision. Retinal binds to opsin proteins in rod cells with formation of rhodopsin, which is a critical substance for low light or so-called scotopic vision. Retinoic acid is a crucial substance for regulation of epithelial cells turnover. In the skin, it regulates the turnover of keratinocytes. In the eyes, it regulates the turnover of conjunctival epithelial cells and cornea cells. Also, retinoic acid regulates the function of our immune cells and mucosal barriers. For example, vitamin A provides the conversion of promyelocytes to myelocytes, which is an essential step in hematopoiesis of neutrophils. So, why vitamin A deficiency develops? What are the most common factors? The most common and obvious cause of vitamin A deficiency is lack of vitamin A in the diet. The second cause is related to bile acids. We know that bile acids are essential for vitamin A absorption, and in conditions like Crohn's disease, the amount of bile acids decrease, which will cause decrease in vitamin A absorption. Another disorder that affects vitamin A absorption is celiac disease, because we know that it's duodenal enterocytes that absorb vitamin A, and if something happens to them, the absorption of vitamin A will decrease. In celiac disease, the atrophy of duodenal villi occurs, which significantly decreases the absorption capacity, thereby leading to vitamin A deficiency. Another possible cause is low level of retinol binding protein, which can be caused by inherited mutation or by decrease in production, which can happen in cirrhosis. As we see, there are a lot of symptoms of vitamin A deficiency, and we have to know why these symptoms develop. Knowing the functions of vitamin A, let's explain the pathogenesis of the symptoms one by one. First of all, with vitamin A deficiency, the amount of retinol decreases, and without retinol we cannot form rhodopsin, which can affect low light vision. As a result, night blindness develops, which is a signature feature of vitamin A deficiency. Also, with vitamin A deficiency, the concentration of retinoic acid decreases, which leads to decrease in epithelial cells turnover. Decrease in keratinocytes turnover leads to follicular hyperkeratosis and dry and scaly skin. In the eyes, decrease in conjunctival epithelial cells turnover leads to formation of embittered spots, which is a squamous metaplasia, and also it causes xerosis, which is a dry eyes. Decrease in turnover of cornea cells leads to corneal ulceration and degeneration. Also, decrease in retinoic acid affects immune system. It causes immune suppression, which predisposes mostly to viral infections. For examination purposes, we have to know that without a proper effect of vitamin A, for example in case of mutation of retinoic acid receptor, promyelocytes cannot be converted into myelocytes, and accumulation of promyelocytes causes acute promyelocytic leukemia. And the first-line drug in this case is all-trans retinoic acid. It's a very popular examination question. Also, we have drug called isotretinoin, which can increase keratinocytes turnover, which helps in acne treatment. But at the same time, in huge doses, vitamin A can be dangerous. For example, vitamin A can cause increase in intracranial pressure. It can affect the state of skin. It can affect liver, and also it can cause arthralgias. So let's explain how each of these symptoms develop. With excess of vitamin A, the concentration of vitamin A in the ito cells of the liver increase, which causes severe oxidative stress with inflammation in the liver tissue. And inflammation leads to fibrosis, so it's hepatotoxic effect. Also, excess of vitamin A affects the state of choroid plexus in the neural system. It stimulates the production of cerebrospinal fluid, and in the same time it decreases absorption. As a result, cerebrospinal fluid accumulates, and this leads to increase in intracranial pressure. This state we call pseudotumor cerebri. Typically it manifests as headache and dizziness. Also, excessive amount of vitamin A stimulates osteoclast activity and decreases the activity of osteoblast. This leads to increase in bone resorption, and this typically manifests as arthralgias. Excess of vitamin A also causes increase in keratinocytes proliferation and differentiation, which results in decrease in formation of stratum corneum. It affects the state of skin barrier and causes dryness. Additionally, excess of vitamin A markedly decreases the activity of sebaceous glands, which leads to decrease in sebum production, and typically patient has very dry skin. And the last feature is related to ability of vitamin A to affect the state of genes involved in regulation of signaling pathways in embryonic development. Massive concentration of vitamin A can disrupt normal morphogenesis. Typically, vitamin A inhibits neural crest cells migration, which leads to formation of craniofacial structure abnormalities. Also, it can affect normal formation of heart and nervous system.